Like humans, monkeys apparently practice the basics of good dental health. For the first time ever, scientists captured on video a Japanese macaque named Chompe flossing her teeth using her own hair. This behavior shows that teeth cleaning and the invention of associated tools is not unique to humans. Jean-Baptiste Leica, the lead author of the study, says Chompe probably developed this technique accidentally. Leica suggests hair might have gotten stuck in between Chompe's teeth. In the process of pulling out the hair, the macaque may have noticed food remains stuck in it. This reward of food may have encouraged her to repeat the action and therefore reinforce the flossing behavior. Scientists observed Chompe using 3 different flossing techniques. The new study will appear in the January issue of Primates. For Discovery News, I'm Casey D. Gardner.
It's interesting. Hey? I have to admit, I have a confession. I have done that before. Wait, let me clarify. I haven't plucked a hair from my rear end and used it as floss. I haven't done that. But I have, you know, when you floss, you see a little piece of food and you think, what do I do with it? And come on, no. That table, back there, you've done it. I can see your face. You've done it. It's okay. Don't be ashamed. We can come out together. It's fine. So, I wanted to thank all of you for coming today. Welcome to our 2017 Patient Appreciation Night. And I also wanted to thank some very special guests. If we can make sure Donna... I wanted to thank some very special guests for coming out tonight. These dedicated individuals are responsible for bringing the latest in products and knowledge to our practice to make sure we're on the leading edge of dentistry. And so we start with Donna, way in the back there. Wave hello, Donna. Thank you. Donna's from Henry Schein. She works hard to keep us on the cutting edge of technology, including the 3D scanning technology that we have in the practice, which may eliminate the need for gooey impressions. I knew you'd like that. We also have Sue from Clear. Thank you, Sue, for coming tonight. Now, Sue represents Clear, and Clear is our supplier of all xylitol products. As you know, xylitol is the kryptonite for dental decay and gum disease, and it's the hidden secret from the dental profession. It's naturally extracted from the birch tree, and it helps neutralize pH. It's not metabolized by the bacteria, and so that way there's less cavities and better oral balance in general. So they come in gums and mints and candies and also nasal sprays. So inside your gift bags, it's not quite Oprah, you're not getting a car, so don't look for keys. There's nasal spray in there, and it's actually, I use it during allergy season when I'm a little stuffy or if I'm a little dry in the winter. And xylitol has a natural anti-inflammatory property. And so when you spray with the xylitol, with the Clear nasal spray, it actually moistens the nasal passages, but also reduces the inflammation. I can breathe better. So try it out. It's a great, great product, and I know you guys will all love it. So we also have Danielle from Oral Science. Wait, hello, Danielle. Oral Science provides us with the most innovative oral health products imaginable. So from the Curaprox Interdental Brush, which you will all hear about tonight, as well as Advantage Arrest, which is the other kryptonite for dental decay. And stay tuned for another Patient Appreciation Night, because we'll probably want to have to talk about that, because that's going to change dentistry altogether. So thank you again for all of you for coming out on your very busy schedules, because it's hard, right, coming out in the evening, but this speaks volumes of your commitment to us. And I can speak on behalf of all our patients. They feel the support that you guys give us. So thank you, all of you. And we have, unable to attend tonight, but here in spirit, we have Dina from Philips Sonicare, who makes the Airfloss. You'll hear about this today. This is a really interesting product. And Braun Oral B. You've probably seen this around our office. Yeah, it's an excellent, excellent brush, one of the best. This is the round rotating, oscillating head is the only head that's been proven to be better than hand brushing. Sonicare is still a good brush, but this is the only one that's scientifically proven to be better than hand brushing. So that's why we recommend the Oral-B. And the smaller head can reach in all the little tiny corners of the mouth too. Most of all, I want to thank all of you for coming tonight and all of your years of support and friendship. Because really, it's you guys that make us excited to come to work every day. And that's why we have evenings like this to thank you all. So, a round of applause for each other. Because thank you for being there for us. Thank you. I really can't thank you enough. And so many of you have left warm, really heartfelt reviews on Facebook and Google reviews. And it really does make us and inspire us to provide a better dental experience each time you come into the office. And I think we're onto something great here. So thank you so much for giving the feedback, positive or even constructive criticism. It's really, we encourage that. And I think that's what's made our relationship different than any other office. So thank you all. So any information from tonight you can find on our blog at www.hamiltondentist.ca. So tonight is one of a series of an in-depth look at how better oral health can affect, and it could be the key to better living. A few years ago, we talked about, remember when we blew up those pumpkins and showed the powerful reaction of oxidation? Well, inflammation is all about oxidation. Antioxidants counters that. And so we explored the power of antioxidants and how it can prevent gum disease and also oral cancer. And just last year, we had a very emotionally charged presentation about the impact of sugar and the impact of sugar on heart health and not just on dental decay, and how I nearly lost my father because I linked the fact that it's not just sugar sometimes, it's the carbohydrates, the white rice, the white bread. So we've had a good series, I think. You know, really connecting more than just teeth, overall better living. So tonight, we're going to talk about, and we're going to challenge the question, do we need to floss? No. You're supposed to be in the peanut gallery back there. I don't know how they put you up front here. So do we need to floss? Do we just throw it out? So let's look at that, and let's give it a good look. It's definitely no monkey business. I had to do it. Sorry. But coming from me, it's really hard to floss because you have to have this, you have to maneuver this arm's piece of length of floss in the back corners of your mouth. And at the same time, you have to find time and energy to do it at the end of a long day. And at the beginning of the morning when you're all blurry-eyed. Right? I understand, it's tough. But the fact is, floss is still the best thing to do to clean between the teeth. But you're going to understand today that it's about finding the right mix and combination that's going to work for your individual needs. You know, for 200 years, dentists have been telling patients that flossing is necessary to prevent tooth decay and gum disease. In August 2016, I had one of those days where you realize that you thought you knew everything about something, and then you realized you were wrong. Because I woke up to this article at the Associated Press, and they looked at 25 dental studies, and it said that medical benefits of dental floss was unproven. Medical benefits of dental floss unproven. What? That's exactly what I thought. So in these studies, they uncovered the fact that although they concluded that dental flossing is helpful to prevent tooth decay and gum disease, the evidence was weak and very unreliable. The fact is that floss is still an important part of our oral health care routine. And so when you look at trying to do a dental study about it, it's hard to do a scientific study because everybody flosses differently. And there's so many factors that contribute to dental decay and gum disease. For example, like you have less saliva flow. That could add to your risk for gum disease and also, most importantly, decay. Or maybe your saliva has a more acidic pH. That makes you greater at risk for tooth decay. Or how about carbohydrate and sugar timing? If you eat the sugars and carbohydrates in the middle of the day, just before bedtime, when your saliva production is the lowest, that puts you at greatest risk. So they're trying to run these studies, but it's hard to do a very good scientific study to do that. When we look a little closer, the highest risk area for decay is between the teeth. So that means that floss fits pretty good in there, doesn't it? The brush wouldn't. So when you look at what floss does, if you don't clean between the teeth, you're missing about 40% of your tooth and leaving it vulnerable to the damaging effects of plaque and biofilm. So what are we really asking you to do when we floss? So basically what you do is you take an arm's length of floss and then you wrap it around your middle fingers, leaving about 5 inches between your middle fingers. Then you use your index finger and your thumb to angle and position the floss in your mouth. Now between your thumb and your index finger should only be about 1 inch. And so by keeping the length of floss between your thumb and your index fingers as close as possible, you'll have the tension on the floss and you'll have the maneuverability to get into those two really tough areas. Except when your floss shreds. That's my fault. That's my fault, so call me.
Come on, Brian, take the floss out.
That's right. That's job security. I'll leave that there, that little sharp edge to shred your floss so you come back. This is what not to do. Flossing should not be an outer body experience. Make sure the floss is inside the mouth and a short length between the fingers. The other thing that you want to do, you know when you floss and your fingers start to turn purple and they start to throb, and you're wondering, you're trying to decide, am I going to lose my fingernail or should I just keep flossing because my hygienist wants me to do so? Well, this is actually a really interesting technique. This is going to help you floss like a boss. So you tie the floss into a loop and you just hold it like that instead of wrapping around your middle fingers. That way there's no excuses. In the late 1990s, the Gap released a very brilliant marketing campaign. And what they wanted to do is they wanted to promote khakis to the masses. So they put people in ordinary pants and made it the uniform of coolness. But the problem is, if everybody's wearing khakis, then you don't have the individual sense of style. You can't express your own individual preferences. So, should everybody be in khakis? Just like floss. Should everybody be in floss? Not necessarily. Because just like your body shape, your preference for colors, your sense of style is very unique, floss is the same thing, because your teeth are all very different shapes. You have very different dental work in there. So what we need to do is we need to look at it more from an individual basis, whether you need to floss or not. And I think that we could probably find with any of our hygienists and also any of us at the office a good routine that fits well between your teeth, but also works well in your hands. For example, teeth aren't perfectly shaped. It's not a perfect world. So there's lots of nooks and crannies between the teeth. And as you can see, floss is very difficult to adapt to the nooks and crannies of the tooth, especially near the gum line where it really counts. An interdental brush, where Danielle will definitely be able to give you more information on those brushes, an interdental brush is like a pipe cleaner. So it has bristles on the sides of it, and it kind of bends and adapts and smushes around to all those nooks and crannies. But most importantly, it drags out all of that debris all the biofilm, all the plaque, all the bad stuff. It pulls it out. Floss sometimes just leaves it in there, just displaces it a bit. So floss is important in the really tight areas where it fits, and then interdental brushes are actually a brilliant way to clean in the areas where it's not so perfect. Although I think you're all perfect in every way. But here the gum line, we can't change that. So dental bridges are used to replace missing teeth. Dental bridges replace missing teeth by joining the teeth together. But how are you going to floss through this bridge? You can floss under it with a floss threader, but that's frustrating. So how about braces? You got the wire in the way. So that's kind of hard too with floss. But people do it. I'm amazed at how many of you are dedicated flossers. Really, because it's tough stuff. And you know what? I think that shows just what kind of relationship we have with you. Because I feel that these talks and all of you are looking for better living, better health, and that's what motivates us to give you info sessions like this. So when we look at interdental brushes, they can fit between wide interdental spaces, they can go around braces, they can go under bridges, and so I think that they're very useful in many ways, they're versatile. But the great thing about Curaprox is that they're customized as far as sizes are concerned. So what we can do is our hygienists can measure the size of the space and give you a color that's specific to that size. So you might have 2 or 3. Mostly we give 2, just to keep it simple. So you'll have 2 different sizes or one size, and you'll use that in specific areas. You'll go pink, and then you'll go blue. So it all depends on what you need for those areas. But you get really good at it. And it looks like candy, it's kind of cool. There's an interesting product that I've been trying for the last 6 months. It's called the Airfloss. So you guys have heard about the Waterpik, I assume, yes? Yeah. So the Waterpik is a good oral irrigator. Airfloss is really interesting because it's smaller and it uses bursts of air. So it has triple burst technology. So when you push the button, it blasts 3 bursts of air through the middle of your teeth. But at the same time, it has a little reservoir where you can put a little bit of mouthwash or a little bit of plain water, and it helps spray this fine mist to help carry that debris through your tooth. And I have to say, I was out with my family one time, and we had shellfish, and I had a shellfish stuck between my teeth. And you know how uncomfortable that is, right? So I said, you know what, for the name of science, for the name of tonight, I'm going to leave this piece of shell between my tooth. And so I suffered for hours. I got home, I used my Airfloss. Yes, all for you. So I used my Airfloss, and it got it out. It was jammed in there pretty good. So for big food particles, I think it's great. I don't think it's perfect, though. I still am worried about getting decay. So I think I'm going to still use the combination of floss and the Airfloss. So basically, you fill the reservoir with a little bit of mouthwash, it's not much, or plain water, and then you position it in the space between your tooth, you press the button, it goes pew, 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 and then it goes on to the next pew, pew, pew. It's really cool. As you guys know, I like gadgets, so maybe that's why I'm excited about it. Just a word of caution, don't do what she's doing. Don't smile in front of the mirror while using this, because you won't be smiling later when you have to clean it all up. It's getting all over the place. I've done that. One time I pressed the button by accident, and it was like, and it was a mess. And Janice, fortunately, I was able to clean it up before she got to the bathroom. Yeah, it's called survival. The water flosser is also a good product. It works. The only problem with the water flosser is that it comes in a countertop version and a portable version. Now these take up a lot of space, because look at the portable version. Okay? No wonder she has to hold on to the side of the sink. She got all over. It's so heavy. Like, look at that thing. So I could potentially see my son or my daughter holding the Airfloss, but there's no way they're going to hold the water flosser. So for practical reasons, it needs to be big. because it uses water bursts instead of air bursts. So you need to fill that whole reservoir with a liquid because it pushes the liquid through. So that's why this has to be so big. So the question is, should everybody be in floss? No, not necessarily. Because what we want to do is find a regimen that fits in with your lifestyle. Because for years we've been trying to encourage you to floss because it is the best way to clean between teeth. It is the best way to keep you out of the dental chair, unless you like being there. Okay. Not for the company, no. So,
The company, it's the procedure.
it's the procedure, it's not the company. Thank you, Carol. So, when you look at it, Gap has put everybody in khakis. But maybe if you don't look good in khakis, wear jeans. So just like everybody should not be in floss, maybe we can find some routine for you where if you floss 2 times a day, every day of the week, great, keep going, do it. Because we know anecdotally it works, even though the studies may be hard to follow and improve. Or if you floss maybe once or twice a week, that's okay, keep doing it. But then why don't we find something else that you can do that's simpler, like the Airfloss or an interdental brush, to fill in those gaps. No pun intended. Oh, guys, come on. I'm going back to the monkey business joke, okay? You better start laughing. So, you can fill in the other days with something else. Something that fits in with your lifestyle. Something that fits in with your abilities. Because, you know, some people have arthritis. Some people have very limited opening. They can't reach in. Some people have dental work that makes it difficult to floss. So we want to work around your lifestyle and around your dental work and around your ability. Because that's important. So if we can make it easy for you and practical for you, then you'll be happier and healthier. Thank you.